All right, and then since it is 12 o'clock and we're trying to stay on time here, we're going to go ahead and get started. Some other people may join, but as we go through, I want you guys to be able to type in the chat, ask your questions, things like that. So I'll start off. Welcome, everybody. My name is Jack Kesselring. I'm the current president of the NCAAOP chapter. And this presentation today is going to be going through some of the updates and things that we have been working on to kind of redo some things in the chapter and get things situated so then we can have more involvement, more activity, and more collaboration as we look at supporting the clinicians, the patients, and the organizations within the state. So starting off, I'm just going to give you a little bit of background of who I am, what we're doing today. So we're going to have an opening and welcome. I'm going to speak about our reorganization and some of our goals. We'll have Dana here that will be talking about the So Everyone Can Move initiative for 2025 and providing some insurance committee updates. And then at the end, we're going to open it up for some closing remarks and questions so you guys can ask whatever you want to about the chapter and where we are and what we're doing. Part of my presidency is going to be being very transparent with you all as well. So I want you to know what's going on, keep you informed, know where to find information, so that we can rebuild and have this collaborative effort across the state of North Carolina. So I'm really excited to have you all here. I'm excited to see all the people who have registered for this call and the engagement that I've gotten over the last couple of weeks. So previously in the chapter, Jim Del Bianco and Shane Coltrane were the president and vice president. So they were doing a fantastic job with the chapter up until this year. And they just needed to step back so they could spend time with their families and their businesses. They were working on programs to support Medicare and Medicaid in the state and made some really good headway with that. So where we are with some of the Medicaid discussions and kind of some of our push for higher reimbursement in North Carolina is because of their efforts. So they've done a fantastic job, and I'm excited to fulfill that mantle and kind of continue this chapter growing and supporting and collaborating with everybody in the state. So as of a few months ago, I was elected by the members of the chapter to be the new chapter president. So a little bit about me. So I am a certified clinician. I've been in O&P for about 10 years now or so. I started here in North Carolina, volunteering and working with a private practice. And then I went to Chicago, did my residency at Shirley Ryan Ability Labs, worked for Hanger in Chicago, moved back here and worked with Jim Del Bianco for a little bit. And then I became the director of clinical education for Townsend Tuan. And so for the past 3 years, I had been doing that and being the clinical educator for them. So I have a really good feel on what's going on nationally in the O&P environment with different manufacturers, suppliers, clinics, what groups are acquiring different things. And I love getting that information from you guys on, how I can support you and how we can make this chapter really be a strong entity and a go-to entity for everything O&P in North Carolina. I have a lot of connections in the state already with entities and groups like NC State's Neuromuscular Engineering Robotics Lab, and with like Duke programs for their postdoc rehabilitation and exoskeletal students. And then, one of the main goals that I'll talk about in just a couple minutes is that I really would like to encourage those groups to come to us when they have questions about orthotics and prosthetics in the state. And I have some ideas on how we can do that. So we're always looking for formal and informal involvement. We have some openings on the board. So if you are interested, I promise it won't take your life away from what you're doing. We want you to be involved. We want to be able to work in this collaborative effort. And whether you're a clinician, a researcher, a patient, a healthcare provider, or someone adjacent to O&P, get involved. There's different things that we need help with, and not all of them are clinically related. All right, so I'm going to talk a little bit about our chapter vision. So of course, we want to support O&P clinicians, patients, residents, and businesses in the state of North Carolina. We're going to continue to support programs and people to showcase orthotics and prosthetics in North Carolina. So having the RTP, Charlotte area, the coast, all these sections of North Carolina that are really big into biotechnology and pharmaceuticals and healthcare, I want this chapter to be the go-to entity for those people looking to find out more about orthotics and prosthetics. So whether that's getting involved with some of the schools like UNC, or whether that's getting involved with some of the organizations in the state like the CAF or Amputee Coalition, those type of entities to run fundraisers in the state, or whether it's even adjacent fields like specialty groups like exoskeleton researchers or bionic researchers. I want to kind of pull all those groups together, so then if they have questions about orthotics and prosthetics, they come to us and we can be that voice. We can be that strong single unity of, hopefully reason in North Carolina about orthotics and prosthetics. So I'm encouraging involvement from adjacent healthcare and academic entities in North Carolina. And I know you guys have a ton of connections as well. So think about, ways that you want to potentially involve them in the future. We want to open membership levels for increased collaboration in North Carolina as well. So then we can have different levels that people can be involved, whether you're a student, whether you're a patient, whether you're a researcher or a clinician. You can have involvement in the chapter and be able to know what's going on, stay up to date with the newsletters, and be involved in, what could be coming in 2024 and hopefully beyond. We're going to continue to fight and support an increased Medicaid reimbursement in North Carolina. So we have discussions going on currently with North Carolina's Medicaid representatives, which we'll talk a little bit more about in a second, and what that looks like. And then we're going to continue to support the National AOPA conference, which is coming to Charlotte next year, and supporting the So Everybody Can Move initiative in 2025, which we'll also talk a little bit about in just a second. So we have a lot of really big things, a lot of really cool things that we will be able to work on and that we'll be working towards over the next 2 years. So chapter updates, this is more of some logistical things that have been happening behind the scenes. So we've had updates to the board. We're also seeking members for some of those open board positions. We have an updated website that has previous newsletters. So if you haven't been seeing or getting those newsletters that have gone out, make sure to update your contact information, which we'll talk about in just a second, and you can see the ones that we've put out so far. We have an updated LinkedIn, so go follow that as well. And then all of our funding and business logistics, such as insurance and liability, all of that makes us an official chapter, are all in place and ready to go. So we have a lot of opportunity now that the foundation and things are set up for this year and the next 2 years to really help and support clinicians, patients, businesses, and organizations within the state. So action items, you've been listening to me talk, you've been saying, okay, Jack, like you're telling me all these great things. What do I need to do as somebody in North Carolina that's part of this chapter? So the action items are update your information so you can at least get the newsletters, stay up to date on what we're working on and, when we need some involvement and what type of activities and programs are going on with the chapter. Pay your dues. So dues are helpful so that we can continue to have these conversations and assign resources to where they're going. We are looking for nominations for board members. So we have some open positions and there is a form out there with a link that we'll put in the chat for the nomination. We are looking for Medicaid information, which we'll talk about as well in just a second. So we have the opportunity that we'll be sitting down with North Carolina state legislatures, and we will be talking with them next week, I believe. Sorry, guys, my Roomba decided to go a little rogue right now. Let me turn that off so we don't get a bunch of vacuuming in the background. There we go. All right, so then follow LinkedIn and get involved. We need involvement, and you're going to hear me kind of beat this message over and over and over again, but we really need people to get involved, especially when we look at doing some of these initiatives and programs in the near future. So whether that's formal involvement as a board position or whether that's informal involvement, I promise we won't take hours and hours and hours of your time away from your family and businesses, especially if we're able to kind of divide and conquer. All right, so one of the big chapter goals for the next couple of years is looking at North Carolina Medicaid discussions and fighting for that increased reimbursement. And Dana's going to talk a little bit more about that and kind of the headway we've taken in the last month or so. We have been able to request a 10% off of the prevailing Medicare rate as an increase for North Carolina. And we'll be sitting down with the legislature in a week or so and talking with them about this and the opportunity to really give them the insight that they can take to the state to really push for this increase. So what we are looking for you as clinicians and business owners is we need to get your top billed codes by quantity. So then we have a good representation of what you guys are billing out in your clinics in the state by quantity. And we'll talk a little bit more about that in a second as well. The So Everybody Can Move initiative is coming up in 2025. So we need your help to become one of the states that can support this program and support our patients. And Dana has more that she'll explain about this. And then next year in 2024, we have the National AOPA conference that's going to be coming to Charlotte. So we really want to band together, really create a good solid entity. So then we can welcome AOPA to North Carolina and really show off the O&P strength in this state. So what we're planning on doing is having a regional meeting in Durham at the beginning part of next year. So then we can kind of rally, get together, have that in-person meeting, get things organized. And then by the time AOPA comes, we'll be a strong single unity entity that we can welcome everybody to North Carolina and show off all the great things that O&P is doing here in North Carolina. All right, so just a quick summary is we're looking at our chapter goals being initially the North Carolina Medicaid discussion. We're preparing for that So Everyone Can Move in 2025. We're preparing for the national conference in 2024 and that regional conference coming up in the first half of the year next year as well. All right, so I've talked a good bit. I'm going to turn it over to Dana so that she could talk a little bit more about the So Everyone Can Move initiative. And then